Guys, let us look at what a triage is, okay? So basically, whenever there's a disaster, right? So there will be multiple casualties. The number of casualties will be very high and the resources will be very limited. So in this situation, how will you manage, right, the medical treatment? So that is defined by triage, okay? So triage is a very specific terminology, guys. So basically here, they will prioritize, okay, who needs immediate care, right? Somebody who needs immediate care, somebody who needs another type of moderately, if they are moderately ill, there will be a yellow code. A green code will be like people who have minimal risk, and black indicates dead people, okay? So this is triage. According to the internet, it is a process of determining the priority of patients, okay, based on the severity of their condition. So you will decide the priority of the patients, right? So basically, what are we discussing today? Triage. Okay, so let us learn about this. It consists of rapidly classifying the injured on the basis of severity. So you can't take a whole day to just classify them. It is rapidly you will classify these patients on the basis of severity with prompt medical interventions and likelihood of their survival. So you will know who needs immediate care. So basically, let us say that usually what I read recently was in US, because of the increasing gun violence, suddenly you will see a spike of gun injuries, okay? And at that time you will have to classify, rapidly classify who is dead, right? That will become black, okay? Then if there are ambulatory patients with minimal risk, so they will decide which is minimal risk, right? Now, what about red? Red is critically ill. Red is critically ill in the sense like probably it has hit their vital organs or something like that, right? So that will be priority 1. Priority 2 will be moderately ill with requiring resuscitation within 24 hours, okay? So basically you have understood what triage is. So you'll rapidly classify the injured based on the severity, okay? So with prompt medical intervention and likelihood of their survival. So you will, for those people, once you have classified them as priority, you will give them prompt medical intervention and help in the survival, okay? So this does not follow the regular first come first serve, will not be there here, okay? No first come first serve. Okay, so basically priority will be based on severity. Okay, the highest priority is given to victims whose immediate or long-term prognosis can be dramatically affected by simple intensive care. Low priority is given to those people who are affected, okay, who are severely affected, but their treatment, their survival does not depend so much. It doesn't need the immediate care. Their survival doesn't need immediate care. Okay. So look at the codes here. You have to write these codes. Priority 1 means what? Priority 1 is red. Priority 1 is red. Highest priority. Critically ill patients who need immediate medical or surgical treatment within 6 hours. Then you have yellow. Yellow is priority 2. That is high priority. This is highest priority. This is high priority, they are saying, okay. These are moderately ill requiring resuscitation within 24 hours. Then you have green. This is low priority, they are saying. These are ambulatory patients with minimum risk. And category 4 is the least. These are dead or moribund patients. Moribund is somebody like who is at the point of death. They have, they are declining. They are lacking vitality or vigor. So at the point of death, okay. So this triage, guys, they should carry it out at disaster site. It is, it's best carried out at the disaster site, okay. So you can decide whose transportation also is priority, whose admission to the hospital is also priority. So you can decide based on all this in the disaster site itself. If you do it, it's good. So guys, there are some terms here that you have to know, like triage sieve. Triage sieve is where you will separate the dead from walking, okay. You will separate the dead and the walking from the injured, okay. So from the injured means they are on the floor, let's say. Dead are dead, you know that. And injured and walking is different, okay. So this is a sieve where you will separate these type of people. Then you have a triage sort. Triage sort means remaining casualties are assessed and allocated to categories. Okay. So you know who is injured. In them, you will assess and allocate categories. That is the sort. What is tagging? Tagging is basically, you will tag the patient with identification, age, place of origin, right? That is the name, age, place of origin. Triage category you will put on that tag, right? You will say whether that's priority 1, 2, 3 or 4. And then you will send it for diagnosis and initial treatment. Okay. Training in triage should be done while training local health workers in disaster management. So you should also train people on how to manage a triage, right? How to do triage, you have to train people. Persons with minor or moderate injuries should be treated at the disaster site or at their homes to avoid social dislocation. Okay. And seriously ill should be transported to hospital with specialized care. So you understood, right? Some people can be treated at the site itself, at the disaster site or at their homes, because the hospitals are just going to be flooded, right? If it is possible, they'll be treated at the site itself. Okay. Then you have types of triage. Okay, triage. So basically here you have the simple triage, rapid triage and the reverse triage. So you have 3 types of triage here. Let's take a table here. So you have 3 types of triage. So you have the simple, you have the rapid and you have the reverse triage. So there are 3 types of triage here. What do you mean by simple? If there is a scene of mass casualty, you will sort patients into those who need critical attention, immediate transport, and then you will categorize them less serious, etc. This is just what we saw till now, right? So this, before transportation becomes available itself, you will do the simple triage. Okay. Categorization of patients based on severity of their injuries, and you will give printed triage tags, okay, or color you can put on tags, color tags you can put on them. This is simple. What is rapid? Rapid triage, there is something called a START here, S-T-A-R-T. This is simple triage and rapid treatment. What is this START? It is simple triage and rapid treatment. Okay. So basically a simple triage system that can be performed by lightly trained or emergency personnel. Okay. So what is there here? Rapid treatment is there. So basically they are saying this is done by lightly trained people. Okay. Now what do you mean by reverse triage? So basically here the less wounded are treated in preference to more severely wounded. Interestingly here they are saying that whoever is less wounded, them you will treat first. Interesting. Less wounded are treated in preference in some special situations. Special situations like war, because you need the soldier to be returned to combat as quickly as possible. So in a war or when you need the army to work, the less wounded are treated first. So this is reverse triage. Interesting, right? Now what are the merits and demerits of triage? Let us look at this part also. Merits and demerits of triage. Types we have covered, guys. Now let us look at the merits and demerits of triage. Okay. So merits of triage. Triage is the only approach that can provide maximum benefits to the greatest number of injured in major disasters. And demerits, it is unethical practice. You have to treat everybody, but you're treating only the severely, or in reverse triage, you're treating people who can go back to the war. So hope you have understood this topic, triage. So remember, priority 1 is red, priority 2 is yellow, priority 3 is green, and priority 4 is dead or moribund. What is that word here? Moribund. We have also looked at terminologies like triage sieve and triage sort. Sieve is what? Dead, injured, and walking. You can separate these people. So walking, they seem to be okay. Injured and then this is dead, right? Now triage sort is where you will, this is actually the prioritization, okay? So whatever casualties are there, that you will allocate the categories. Priority 1, 2, 3, 4, okay? So sort is actually what you're doing. Sieve is before the sorting itself, you will see who is dead, gone that side, who is injured, gone that. Injured will probably come to the sort, correct, no? Okay. And walking also can come, some walking also can come. So that's all for now in triage, guys. So triage, where and all you will have to do in time, if there is a train accident or a bus accident or some kind of a mass shooting like how it happens in US, pretty common there, because people are having a lot of access to guns and they can own more than one gun, and I have a feeling they can own innumerous number of bullets, which that doesn't make sense to me, because in India some people are given a gun with a lot of difficulty with license. They do get one gun with 2 bullets for which every bullet is accountable. However, they do not have such accountability for bullets is what I feel. Okay, so they are also unwilling to give up on their guns. Anyway, so remember triage as a medical personnel, disaster management, you have to know this terminology. Triage for your exams. Okay, bye-bye.